Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about perimenopause and menopause with Dr. Jessica Shepard. But before we get into it, a few things I want to make very clear. One, we are not giving any type of medical advice. If you have any questions about your health, please speak with your friendly neighborhood healthcare provider. And if you have any questions about your religion, please speak with your neighborhood religious scholar. And this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I am super excited to have on with me Dr. Jessica Shepard, who is looking fabulous from Dallas. And Dr. Shepard, if you could please introduce yourself to all the listeners and the viewers out there.
Absolutely. I'm Dr. Jessica Shepard. I'm a gynecologist. I really focus on midlife health, and that's going to be perimenopause and menopause and also longevity. And, I really do love what I do, and bringing into that fold of good midlife medicine is also the mind-body connection and really helping women focus on this journey in their life and really looking at it a holistic way. And I just had a book come out October 1st, Generation M, Living Well in Perimenopause and Menopause. And so I'm very proud of what we've been able to do in the community with this book.
Amazing. Well, that is fabulous. And I definitely want to get into the book and hear what it's all about so that the women and the listeners and the viewers out there can pick that as a holiday gift
Yes.
for their families and for the women in their lives so that they can live their best lives in perimenopause and menopause. So maybe you could tell us a little bit about yourself and your journey. And so you are a gynecologist, right, and practicing as a gynecologist, but at some point, did you practice obstetrics as well?
Yeah, I love this question. So, OBGYN, we learn both in our 4-year residency. But throughout residency, I really realized that I love the ability to be in the operating room. And with that, I really focused, probably from my second year on, as really looking at the surgical aspect of gynecology as something that I really wanted to focus on. And that's exactly what I did. I did a 2-year fellowship in minimally invasive gynecology after residency. And during that time as well, which is also, fast forward, you'll see how it kind of has inserted into my life, got my MBA. And when I finished my fellowship, that's when I really dove into just being really high surgical volume and really helping women with they had, kind of complex fibroid disease, endometriosis, prolapse, all of those. And I spent a good 12 years really focusing on surgical interventions and helping women in the OR. And what I started to realize over the 10 to 12 years was that I noticed that women, when they were in that midlife phase, so anywhere from, let's say, 42 through 52, there's this gap in care, but also their experiences and how they felt, what they felt was going on in the shift. And, for us, being a gynecologist, I quickly knew that, oh, well, this is the perimenopausal phase, but we weren't, traditionally trained to
At
really
all.
address all of the different things that come through that, whether it's
Never.
mood,
Mhm.
libido, sleep, changes in your gut health and your weight. Um, and so that's when I really had to step outside the box of what I had known and really onboard so many different modalities, mindset, treatment plans, protocols for women during this phase, which is why now my practice is really basically on midlife for women.
Nice. Amazing. Are you still operating?
I actually stopped operating probably, I would say, a year from today is when I probably did my last surgery. And it was so sad because that is like my hashtag, kind of thing that I did and everyone knew me for. But I do believe that this next phase and what I'm doing in midlife medicine is exactly where I'm supposed to be at this time. And I thoroughly enjoy it. And so glad that I had that time and passion to be able to help so many women. I still get like emails and DMs about, you helped me when I had this surgery. And so
Yeah.
that's so wonderful to hear. And again, is reassuring that I did really good work while I was in that surgical space.
Absolutely. And it's amazing how just being an OBGYN, right, that becomes part of our identity. And so when we give up one or both parts of that, whether it's surgery or delivering babies, it's almost like we're saying goodbye to a part of us, right? Because it's so
It
ingrained, because
is.
that's kind of who we are. So I totally feel you on that. Yeah,
Yeah.
I get that. But like you said, you're doing so much other work, and you're doing such important work. Like you said, we don't really get trained at all. I didn't get any training at all on menopause, perimenopause. I got nothing. I was actually a second year resident when that WHI study came
Oh
out
my
in
gosh. Yeah.
2002.
I can imagine.
And, it was literally overnight that they said, forget it. Estrogen is bad. We don't do that, and then we didn't get any training. I mean, we didn't learn
Yeah.
anything. And I don't know what it was like in your residency, but I learned zero.
Yeah, it was that kind of, phase where we had like the two tools in the toolbox. There was no art to it. There was no variation to it. And, quite frankly, back then you had to be menopausal to even be considered for
Right.
hormone replacement therapy. And now, obviously, we've changed the game, and perimenopause is a beautiful space to start introducing hormones. And so back then, it was like, one, you had to be menopausal, and two, we had like very little to give. And I remember women, in my residency years and complaining of these symptoms. And in your head, you're like, okay, well, that sounds like, menopause, but we didn't attribute it to perimenopause. But then as
Yeah.
soon as we found out, oh, well, you had a period 4 months ago, I can't, we're going to have to wait until you have 12 months of
Yeah.
no cycle for us to really enter the phase of, okay, now we can treat you. And so I
Yeah.
think it's one, it's great to be able to see medicine advance the way it has. And now we do understand much, better that we can treat perimenopausal women, but then it does kind of reflect on, for the ones in the past who didn't get that benefit, it makes me a little sad.
Yeah, absolutely. I mean, definitely so many generations of women, right, didn't get treated with hormones. I know my mom didn't get any treatment at all. And you see how they struggle
Right.
with all of their joint pain and the osteoporosis and
Hmm.
all of that. And it really is unfortunate. Also, I want to kind of go back to what you said also about sexual health. I mean, that's something, again, that we don't learn anything about. I didn't, at least in my
Hmm.
residency, I learned nothing about sexual health, nothing about libido, desire. And we know that so many women during this time will come in with decreased libido. I think, what is it? Like 40% of women will experience
Hmm.
decrease in their libido over their lifetime. So, we don't learn anything about that at all. I'm curious to know whether or not you learned something. And then how did you learn more about sexual health?
Yeah, same scenarios where in training you learn more of the biological features of what's going on, and not, to me, I term it more sexual wellness. And for every human to understand that they're a sexual being and understand the difference between pleasure, desire, libido. And I think we did not get that. A lot of our years are spent in that reproductive phase, and
Yeah.
usually, how does one become pregnant, right? And so the beauty of now how women can embody themselves and see themselves as a sexual being and understanding pleasure is, again, some of how I consult or talk to my patients and manage them in that way, giving them the opportunity to share where they are in the journey, what issues they may be having, and really being like direct in that, and not trying to put it in context of that it's a hidden conversation. And then giving them, so there's so many tools that we have now than we ever had before. And I think that most women are unaware, one, two, that they deserve pleasure, but two, what are the kind of modalities and treatments that are out there. And I'm glad to be a part of the kind of uh, advancement or positivity in sexual wellness.
Yeah, absolutely. And I think so much of that begins with giving yourself permission, right? I
Hmm.
think that sometimes women may think, or if, depending on the way that they were raised, maybe it's, sex negativity that they were raised with, maybe it's the culture, maybe it's the community. But, a lot of times women don't realize that they need to give themselves permission. Oftentimes they're always seeking permission from others, but it's us that's holding ourselves back, and realizing that when we give ourselves permission to accept and seek out pleasure, then we can move forward in our relationships and become unstuck. And I think that that sometimes is a barrier.
Oh, absolutely. I think it's a barrier. And it's a barrier that's we see very rampant in society, like how we position ourselves, what we're taught, what we're told, whether that's through religion, like you said, or culture based. Society also does have a very strong patriarchal type of
Yes.
overshadow in women, and when we think of sexuality.
Yeah, absolutely. Absolutely. So I'd love to hear more about your book. So tell me what the inspiration was behind your book, and how long did it take you to write your book? And, it looks phenomenal. I'm going to have to order it right after we get off this
Yeah,
podcast. So I
yeah, we'll
have
get
it.
you a copy. Yeah.
Yeah.
No, what really drove me to write it the way I did, and I was approached by a publisher company, and they wanted me to write on menopause. I kind of pulled perimenopause into it because I realized that was such another
Yes.
kind of landscape that really was
Yeah.
being missed, because that could be up to a 10-year time frame in a woman's life
Yes.
going through perimenopause. I
Absolutely.
knew from the time that I got the deal that I wanted to write it in a way that was compassionate, but also that the language in it felt relatable, felt
Mm,
that women could be at all
yes.
spaces, but also not too medical, because
Mm,
here's what I think about menopause is, 40% of our lives are spent in that phase once we, go
yeah.
through menopause.
Yeah.
And I think about agency and our lives as we start to age is that we actually need to have some really strong fortitude and mental capability to, one, push through it because you're getting older, but two, truly understanding who you are and what you desire, even with external forces that may tell you otherwise. And so I think a lot of it really focused on the mind body connection, because most of the patients that I were seeing, a lot of them were dismissed, say, when they had an issue of how they felt, because as physicians, we're taught, oh, well, your labs are okay, so you're
Yeah.
okay. And
Right.
there, many patients are like, but I don't feel okay.
Yeah.
And so I wanted, Generation M to really be this mind body connection, holistic in the sense, as much as I'm a hormone advocate and I love hormones, that's not everyone's journey. Maybe everyone's not ready for it at the time that they hear about it or introduced to it. Some can't. But I think that it should never be this kind of one hit wonder of it's either this or nothing. There's so many different fields on how someone can lend their experience as they go through menopause, and it needs to be something that is collectively put together so that they're not piecemealing all these different types of information to make it relevant to them. And so we talk about food, we talk about sexuality, we talk about rumination and anxiety and depression and how to bring the mind back to body. Because that is a lot of what women go through for years as they go through
Mhm.
this, because they're very unsure of what's happening. It can be frustrating, it can be scary. And so all of that can play in your mind and different thoughts. But how do we bring that down and allow women to feel what they feel, but also not feel victimized by that?
I love all of that. I think that's amazing. I do a lot of so I do sex coaching. And
Mhm.
so I talk a lot about the similar ideas in terms of like rumination and ruminating
Yeah.
thoughts and how that can keep somebody stuck in their relationship and not able to move forward because all of these negative thoughts. I have actually a client right now that I do coaching with, and she and her husband have been dealing with this for 3 years. And she has all of these like negative thoughts about her relationship, even though it's like this beautiful relationship, but she
Mhm.
just can't see it because she lets the thoughts from previous relationships hinder her. And so she keeps thinking about like these, oh, he's going to leave me, oh, this and that. But
Mhm.
it's not the case, even though he's never given her any indication, but she just can't move
Yeah.
past these thoughts that she keeps telling
Mhm.
herself. So it's really difficult when you start having those, ruminating thoughts.
Yep.
And there's a book, I don't know if you've heard of it. It's called Soundtracks by John Acuff. And
No.
he talks, so that's what the title soundtracks is kind of like a soundtrack that you're playing in your head over and over again,
Mhm.
and how to break that cycle.
Yeah.
And, he talks about doing like affirmations and things
Yep.
like that. And that's like one of the first steps. But yeah, I love how you bring the mindset because so much of what we do and what we believe are due to our mindsets and the ways that we were
Mhm.
raised and our beliefs.
Yeah, I think our beliefs are a big part of it. And if you think, mid-age, so most people are going to be, in the realm of what, 47 to 52, going through that menopausal phase. And think about how long it took you to build those soundtracks, as you call it. And so there is a lot of work that has to go into how do I realign or reshape that soundtrack to benefit me in the best way.
Yes.
And even me as a perimenopausal woman, there are these things like these are also personal stories of,
Yes.
me being vulnerable to these changes that occur and what do I do when they come? Because it is very out of self feeling, out of body feeling. But I know I definitely like I'm a positive, firm advocate believer of what we can do in our lives through mindset.
Yes, yes, that's so powerful. Our mindset is so powerful. What I'd love to know about is actually, so you're seeing patients right now in your office. Is it perimenopause? Is it menopause? Do you focus on other things? Do you do procedures also in your office?
Yeah, we do kind of all of it. So it is primarily based perimenopause and menopausal women. In one, usually it's a consult because they want to know, from a lab feature or a symptom feature, what can be done. And, for me as a medical provider, I want to be able to obviously give them the education first, a good foundation on what hormones are, if they need them, if they want them, how they're given, the various modalities. Many
Yes,
people are unaware of the various modalities that you can get it, and then factoring in their storyline on top of that, right?
sure.
So it's not kind of like this is what we do and then you smack it on them. It's kind of like let's hear where you are, what your journey is like, and let's find that kind of common ground in what we're able to offer. But also we do procedures because they're again looking at all the different ways to do it. We do vaginal laser for atrophy. We do PRP injections, which work beautifully for people who have tissue disturbances, whether it's in the vulva or the vagina, clitoris if they like. And then we also do, because who doesn't like to look good on the outside as well as feel good
That's
on the inside?
right.
We
Absolutely.
also do a lot of aesthetic procedures here with like laser and radio frequency, Botox and fillers. But from the sexual aspect, I even have patients who, just because of where they are for whatever reason, want surgical labiaplasty, and we do those as well. Because
Sure.
I don't think that women should be judged on what they're going through, why they feel the way that they do. Now, we do have very good conversations for anyone who wants to start any of those procedures that we discussed. One, helping them understand what it is, why it's done, what comes with it, and risk and benefits. But also, with all the other offerings that we have to give you, where do you want to start right now? Because
Right.
the other thing, too, is you have the agency to change your mind. And so, for patients who might start on a form of HRT, then say, let me look into PRP. They kind of like, I'm like, let's play with it. You get to dictate this journey. First of all, it's a marathon, not a sprint.
Right.
And I want you to ease into something and not feel that you were forced into it. It's so wonderful to see them be able to look at the variation of where their life is and what's available, not to feel shame behind it, but to have the vulnerability to open up so we can find the best solution for them.
I love that. So, I know that there are not that many women of color up
Hmm.
on, social media talking about perimenopause, menopause, and as a woman myself, a woman of color, I'm Pakistani, and
Hmm.
so I don't see a lot of women that look like me that are talking about these changes.
Yeah.
How do you see your role as a woman of color and, helping to advocate and navigate this, path, this new phase in women's lives?
Yeah, I'm pretty, aggressive when I say I really want to bring women of color to the forefront when we talk about this phase. One, because I think the experiences are different. We've seen that in studies. When you think of the SWAN study, they looked at, the most common symptoms, which are going to be hot flashes and night sweats, that typically Hispanic and Black women start earlier with those
Yep.
symptoms. They're more
Yep.
intense and they last longer, right?
Yes.
Now, when
Hmm.
you look at the modalities and what's offered, just if you're to take HRT, then you're looking at some of the least amount of women who are going to be exposed to it or, maybe be amenable to it and
Right.
offered it are the lower number. So clearly there is a very big gap there in knowledge, education, availability, offerings, but also changing the architecture of their ecosystem when it comes to midlife, right? A lot of these things come with shame behind it, and so it's not discussed, right? Then there is again, what you've heard from previous generations of what's good for you versus what's bad for you. And then there comes that too, with I'm not open to maybe starting some of these newer modalities. And I can understand why, with healthcare and trust with these communities. There is a barrier there. And so I find it is my responsibility as someone who does kind of have, I could say, an accelerated understanding of one, the studies behind it, how it impacts these communities, but also knowing what's available to them and bringing it into a very thoughtful and intentional conversation with these communities as a woman who looks like them. I think that has a very big part in how I choose to show up in these communities, and also to make sure that people who do have the best of resources and access and education, that they do know that that also needs to be part of their kind of reach as well.
Right, right. No, I think that's so important. And I'm so glad you're out there spreading information because it's so important. I think that women tend to gravitate toward women that look like them, right? And if they know that they can talk to them about their shared lived experience, I think that that goes a long way. And, I noticed that for me, I'll have a lot of women that are Indian or Pakistani reach out to me because they see, a woman that looks similar to them. And I'm wondering if that's the case for you as well. I'm sure there are women of all different ethnicities that reach
Yep.
out to you, but
Yep.
do you find any that perhaps women of color tend to come to you more because they see somebody that is looks like them?
Yes, I absolutely do see that, and I welcome it, and I honor it, because that is a big step. For a long time, and if you think of all health conditions or categories and disease states, for say, if you're to think hypertension and diabetes, when you look at these communities who suffer the most, again, a lot of what creates those numbers and statistics is the inability to find someone who they feel safe with or represents them, looks like them, might have the same shared experience, and that's where that gap is. So I treat it just the same as, when we see risk of dementia, heart disease, osteoporosis, being kind of long, the long game, and what happens in women as they're in their 70s, 80s, and 90s, because not being addressed properly in their midlife, then that is another reason why I want WellSpan and HealthSpan to be part of also a woman of color, their narrative too. But we have to be able to really get that community together. And that's why it just needs these conversations that like we're having right now need to happen over and over and over again until we're really reaching a broader number and a larger number within these communities.
Absolutely, 100%. And, I see that, and there's so much great work, right, on social media that's happening, bringing more perimenopause, menopause conversations into the limelight. But like you said, I think that it really is definitely, I think, a good idea to have more people of color. So I recently went to Pakistan back in February and a little bit into March. And when I went there, I have a cousin who's a gynecologist over there. And so when I was speaking to her about what she tells her patients, about menopause, perimenopause, she tells them nothing because
Mm,
they don't have the medications there. They don't have estrogen. They don't have progesterone. In fact, I brought estrogen for my cousin who's there, and I told her she couldn't take it unless she had progesterone as well, and she couldn't find it at any of the pharmacies. And she said they didn't have it, and so
wow.
there is definitely a lack of access. And so I'm so grateful that that I'm here in
Hmm.
the U.S. because there is we do have access to information, we have access to knowledge and access to medications.
Yeah.
But it's really tough when you don't have those medications, you don't have access, and then you see people in other parts of the world that do have access. I think it makes it definitely limiting for
Hmm.
those that don't,
Right.
and a lot of relationships suffer as well.
A lot of relationships suffer. And again, I think when I think of sexuality and sex culture in the Western world, I think one, it has always been, I say this when I speak in public forums, is that we've created this, it's either a nun or a whore, right? There's like no
Yeah.
gray area in between. And so we don't allow women to appreciate the gray area. They have to kind of pick one. And so women, when they are having issues with sex or intercourse or intimacy, many times it's not discussed. And
Yes.
when it is, it comes from a place of this is something that needs to be addressed for someone else and not for themselves. And so I think we need to do a better job, starting with our younger women in how we educate about that and how we can still have a very healthy sex life, but appreciating your individuality in it and what you have ownership on.
Yeah, absolutely. And I agree with you 100%. I did a talk about sex education and a lot of the research. And if you look at the Guttmacher Institute, they
Mhm.
talk about how sex education has a lot to do with your zip code and where you are in the United
Yeah.
States and what you learn, right, as a child, as children in the school system, because a state might focus more on abstinence, whereas
Hmm.
another
Hmm.
state may focus a lot more on, STIs. But we aren't talking about consent, which is unfortunate. We're
Hmm.
not talking about
Yeah.
consent. We're not talking about intimate partner violence. What are the, red flags, what to look for. And so our young individuals are not learning about that. And even if we are in a state that all they focus on is abstinence, right, then they're not learning anything about pleasure. They're not
Yeah.
learning about how to protect themselves from pregnancy and all those other things.
Exactly. And I think that actually is more of what I see than not is this kind of purity culture
Yes.
in where there's no autonomy in that, right? So it is very kind of fixated on goals, which is please your partner and also pregnancy.
Yes.
And there's so much more of life that's lived outside of those, two. And if there's more, kind of topics, and so we have to expand that experience and understand our lives within that, while still that those can still be part of the narrative, but more than two or three things can be true at the same time.
Yeah, absolutely. And I think that, that's why it's so important when you started to talk about, how we talk to young kids about sex education and about their sexual lives. I think it's really important to talk about these other
Hmm.
aspects, right? Talk about consent, talk about pleasure, talk about protection against pregnancy, talk about protection from STIs,
Hmm.
intimate partner violence, all of these things that oftentimes are not discussed, but are really important. And then how do we go from changing a community or a group of people that have been been raised with sex negativity to sex positivity, right?
Yeah.
And how do we prevent the next generations from having that same sex negativity?
hmm That has to really be started from like the foundation up. And when I say that, I mean starting with our younger generation.
Yeah.
Because most people, by the time obviously they hit their late 20s, 30s, have already have a very pretty dialed in foundation on what they believe.
Yeah.
And I think that it should be really started with a younger generation because that's where you start to, really form more of a positive connection with sexual identity than negative. And again, the more, and you said it earlier, the more that you spend time on like vilifying the bad context and the fear and shame, message that goes with that, I think that also doesn't provide someone with the best tools that they have for later on in their life.
100%, yes. And so that's what I find in a lot of, really conservative cultures is that, there people are raised with the idea that sex is wrong, shameful, dirty. And so then they go off and they get married, but they don't know how to move past those thoughts that and those ideas and those beliefs that sex was always wrong or dirty or shameful. And then we see it impacting their relationships and also if they are not able to consummate their marriages, their partners may have erectile dysfunction, premature ejaculation, the women may have vaginismus, right? So then it ends up becoming a bigger problem because of what we were taught when we were younger.
hmm
And, trying to then move on, it becomes really difficult. So then we really have to work on our beliefs and our thoughts
Yeah.
so that we can change the feelings that come about and then change our actions.
Yeah. Changing actions. And again, like you said, changing is not easy. And
Yeah, I
so
know.
that's why, again, going back to younger generation, trying to change someone's complete ideation of what sexual journey looks like, who they are as a sexual being, is much harder to do later on in life, and also
Absolutely.
can bring up some really troubled areas for them based on what their beliefs were in the past or experiences that they've had based on those beliefs as well.
100%. And, I noticed that, people can experience sexual trauma, sexual
hmm
abuse. So that also leads into, their belief system and what they may have experienced. And then to try to move on to sex positivity may become
Yeah.
really difficult for them. So I would love to know, and I'm sure the listeners and viewers would love to know what's next for you. So you've written a book, you have this thriving practice, you are on the media. I see you in the media. So curious to know what's on the horizon for you.
Yeah, on the horizon 2025 is again, the book was able to really open up this kind of vault into how we can start this conversation in a different manner with so many more people. I have people who write me from Europe and Canada who've gotten the book. And so, even from like this global connectivity is bringing what I know, what I've been able to create with community with women who have read Generation M, is to bring that into a platform. And so we're looking more on a platform perspective of bringing the book to life, say, and helping people
Nice.
understand as they go through this journey of perimenopause and menopause is what does this look like from a lifestyle perspective?
Mm,
I made sure that, the hashtag for this book was evidence-based lifestyle approved because I want it to be something enjoyable that people start to incorporate these things into their lifestyle, that they'll have just a better outcome overall. Is looking at food choices, looking at how we can exercise differently, but also really giving this fundamental kind of baseline structure behind perimenopause and menopause as a condition and what happens as you go through it, but also the choices that people have to make in what they can and can't do, which is what we spoke at the top of this segment.
mm. I love it. That's fantastic. And so, for all of our listeners and viewers out there that may be watching this and saying, wow, I just love Dr. Shepherd. She is amazing, intelligent, and gorgeous. How can I work with her? How can I come and see her as a patient?
Yeah.
Um, how could they come by and see you?
Yeah, so my practice here in Dallas, and obviously we do telehealth as well. I have a lot of patients who are through telehealth. Is Sanctum, Sanctum, well is our practice, and you can find us there at sanctumwell.com is our official website for the practice. But also, as far as information to just get from like my newsletter and join the community, is jessicashepherdmd.com, and that's SHEPHERD.com. And then on social, I think most people kind of know me through social media, which is just Jessica Shepherd MD on Instagram. And then Modern Meno, MODERN,
Mm.
Meno, MENO, is kind of like my platform just devoted to perimenopause and menopause education.
Nice. Wow. So you have so many different ways that people could get in touch
And
with
they get the
you.
book.
Yes, of course, your book. How could you forget that?
Yes,
That's
and
right.
get the book. So this is again
Yes.
a Barnes and Noble uh, is where you can get the book online or in stores, and you can also get it on Amazon as well.
Amazing. Fantastic. Well, I'm going to go buy my book, that's for sure. And well, thank you so much. Is there, so before I let you go, I always like to ask my guests if there are any, last pearls that they would like to leave the listeners and the viewers with, something that you think is so important that people should absolutely know and understand.
Yeah, I really believe that this journey is meant for everyone to take at their pace. But I also believe that this journey is full of community and connection. And I hope that everyone, through whoever they find or talk to going through this journey, is knowing that they're not alone and that we can all do it together.
Yeah, I love that message. It's so hopeful. And that's what I love to leave people with is hope, right? Sometimes we become hopeless and think that there's nothing that they can do, but knowing that there's always hope. So, and there's people out there that can help you out, which is fantastic. So, thank you so, so much, Dr. Shepherd, for coming on to my podcast and for giving us this wonderful talk about perimenopause, menopause, and letting us know what we can do and how we can empower and educate ourselves and find women that look like ourselves to go and learn from. So thank you so much. And well, I am done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you have any questions about your health, please speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.